There are so many things that are toxic to us, but yet we're allowing ourselves to be exposed every day and then not testing for some of the things there that can be tested for. So we first need to remove the toxins, but that's not good enough. We need to replace them with good oxygen, high levels of oxygen when appropriate, with the food that's real, that's not fake food, high quality food with nutrients to help heal everything. And then we need to replace it with herbs and healing supplements. And sometimes just real food isn't enough. We have to re-inoculate with probiotics, for example. Sometimes we need some pro and postbiotics. We need other supplements, which is a topic for another day, to help heal the gut beyond just nutrition, and then repair the gut. There are techniques we have to reduce inflammation, reduce swelling in the GI tract, tighten up those cells to reduce the permeability, support our liver, our immune system, and our kidneys. And then we need to live in a rebalanced state, which involves all of the lifestyle, as well as these 4 R's, which we've added a 5th to, which is let's live in a life of rebalance so that we don't have intestinal permeability.
Let's look at how dangerous the mouth is. Let's share some of these statistics. Let's look at oral cancer. In fact, oral cancer ranks as the 13th most common cancer worldwide. And so we have to understand that many of these triggers of causation are from the oral bacteria. They're named in the development of cancer. They can ignite inflammation, what we've spent lots of time on here. They have an impact on the cell cycle, and they can even produce carcinogens. So we need to be screening and looking for this. Well, how about pregnancy? Oral bacteria can actually cross the placental barrier. And so they are named in many things like infertility, intrauterine infections, preterm birth, low term birth rate, and unfortunately, even fetal death. But what I find so fascinating is look over here on the right, that the placental microbiota, so its microbiome, is more closely resembles that of the oral microbiome of the mother than that of the gut. So we have to remember these close relationships, and that it's so important that we understand if the mouth is putting us at risk and even putting our future, I say, legacy babies at risk. Well, how about brain health? Dr. Pritchard explained that vascularly, how that can cross over. But these oral pathogens have been deeply studied and shown to kill off brain cells. They help in the creation of those amyloid plaques, and they can even induce brain inflammation. And then diabetes. All of us should be well versed in diabetes and insulin resistance because of the statistic around this. It's very startling that if you have been diagnosed with diabetes, you're about 90% more likely to get periodontal disease. What I want to share with you is that these are my children. These are my 5 children. And I'm going to ask you, which one is a diabetic? I'm going to let you know from a mother's point of view. Yes, it's my little guy, my youngest there. He is a type 1 diabetic, and it's really opened my eyes into this correlation of infection and inflammation. But what I want dental colleagues to hear, and even my physicians and MDs, that just treating the periodontal disease, we don't even have to talk about how good the treatment is, just actually doing some level of treatment can help our diabetics, whether type 1 or type 2, lower their A1Cs by 1%. That is more than many times what our lifestyle and diet can do. Also, treating periodontal disease can decrease their related deaths by 21%, and we will save an average diabetic patient about $5,000 a year. So this is so impactful, and I hope that you hear my heart as a mother of a diabetic, that we're not only talking about reducing his risks, but we're talking about the financial impact as well. We can make a difference in our patients' lives. So oral is systemic. I love this picture because we're really looking at the big vascularity here of a human. And I want you to look at the heart down here. I'm actually going to start backwards because most people don't even recognize. And you were talking, Dr. Pritchard, about the coronaries around the heart. And then we go up into these carotids. And I want everyone to see that this is around that thyroid going right up around The oral cavity, look at the vascularity. This isn't even talking about microvascularity because there's so much going on. You wouldn't almost see it's like a spider webs in here. But I want you to understand the main, I call it highways that are going on from, think about that airway, our oral cavity, right? Our airway to these pathogens to these plaques. Look at the highway there that is so easily accessible. And so we have all these statistics. You are 70% more likely to develop Alzheimer's if you've been struggling with any level of periodontal disease for 10 years or more. So think about those patients you might know. Like I said, 95% of Americans with diabetes also have periodontal disease. We can increase our premature death rate by 12% higher risk. We've heard today how 50% of heart attacks and strokes are triggered by these oral pathogens. And as far as our fertility and infertility, we have a 7 times increased risk of adverse pregnancy outcomes. And this is just not for women. We cross communicate these pathogens, so we have to look at both partners. And so we're even seeing an upward rise of up to 50% greater risk of developing cancer. These statistics are startling, and we need to know that so we can collaborate, looking at somebody's medical history, looking at their root causes, and putting these together and starting then with the mouth. I share those statistics because we talk a lot about risk. So let's look at here. This is from Aetna in Colombia. Yes, I'm going to go there with insurance. Let's take a look what they wanted to look at here. And they're saying, hey, if somebody intervened with early, we're not talking advanced, right? To pull their teeth out, losing all their teeth, or aggressive or severe. We're talking about early periodontal treatment. Look what it resulted in: lower medical costs for our diabetics, for our coronary artery disease, and our cerebral vascular disease. Well, how big of a lower, what I'm going to say, lower costs and lower risk? Well, let's look at risk first. Look at these percentages. They are from 29% here all the way to 24. This is a greater reduction than what many patients can get with medication. We need to be aware of that. Well, how about the medical cost reduction? Look at these numbers. These are huge. We're talking double digits here, thousands of dollars, and look at the percentages. You can have a huge impact on your patient's life, because some of the most stressful things that we deal with are these inflammatory diseases, but the costs associated with that. So we can track this, that we're not only reducing risk, but reducing those health costs. So let's understand, we're talking about early treatment. Well, we have to look for disease early. So how do we even develop periodontal disease? I want you to understand this 3-step process that happens. The first thing is what we've been talking about. We have to get pathogens. They have to colonize. They have to show up. That is that first phase of dysbiosis. Once we have the pathogens there, then they start the host response of this chronic inflammatory response. That response doesn't go away. It is called chronic inflammation. All these inflammatory processes that we're talking about, that inflammatory process then ignites that bone loss. It's actually attacking itself because we don't stop the inflammatory process. And that byproduct is we lose bone. We lose bone in the jaw and mainly around the teeth. When that happens, we call it periodontal disease, because that's the name of when you have bone loss. So how do you actually get these pathogens? Well, I want you to understand the bacterial shift to health, to dysbiosis. And so as you're looking here in healthy, we have these early colonizers. All these in this green section are called early colonizers, or considered healthy species. It's not until they are not removed on a regular basis and have to start over. But if this biofilm, as you see here in yellow and blue, continues to maturate over time, they'll start to shift from aerobic to anaerobic. Remember that airway, we can be desaturating, and we start to get this first level of dysbiosis, this F nucleatum. We say FN. He's the gatekeeper. And then all of a sudden we have this robust burst of pathogens where they do not need a bunch of oxygen, and they are considered these red complex. They show up. Once that happens, game over. You are now have periodontal disease, you are infected, and the inflammatory cascade is taking off. So you don't feel this, you don't know this. You can't feel these pathogens maturating, you can't feel them growing, you can't feel the shift. You have to know the process, and one of the only ways to know if it's happening is through testing. So I want to debunk a few myths about periodontal disease around that, and that is that we kind of been hanging our hat just like we do with Framingham scores, if you know that from heart disease. It's like these standard studies that everyone kind of agreed that's how we diagnose or look at the risk level. Well, we're just as guilty in dentistry around that, that we've been kind of just saying, well, if you have a pocket, so if you have a bone level between 1 and 3, you're okay. So then we just say, well, gosh, anything over a 4, now you're in trouble. Well, we've debunked that through the science. Look at here where these red pathogens, remember we showed in that dysbiosis, these are these TF, we're going to name them TD, PG, and AA show up. They're there in these pockets, those measurements as little as 2.5, they're there. But what I want you to take a look at is this shift when the pathogens take over. Remember, we saw the dysbiosis grow. That is happening as little as a 3 millimeter pocket. Not sure where the 4 came from. So we need to get clarity around the science. A lot of us are confused, and that's where we say confusion. This is your first step in dentistry of clarity. And so let's get some clarity around bleeding. We say, oh, it's only in danger if there's bleeding there over a certain amount when we touch that tissue. Well, guess what? Same thing. These red pathogens are there in as little as 10% bleeding. In fact, our rule is, oh, it has to be over 30%. Well, look at that, right around 35.5%. Again, these red complex pathogens are taking over. And so we have to be very clear now and get our clarity around the science so we can become competent in our treatments.